and thank you for signing into the All Access Interpreters online training portal. My name is Sarah Baregza, and I'm the Director of Human Resources, and I'll be walking you through the HIPAA training for interpreters. The training should take less than 30 minutes, and at the end you'll need to complete and pass a quiz in order to receive a certificate of completion. The objectives of this course are to define HIPAA and how it pertains to interpreters, to determine when and how to use patient information, to ensure how to keep patient information safe, and understand what to do in case of an incident, and then at the end we will validate your knowledge with a quiz. What does HIPAA mean? HIPAA is a law that was passed in 1996, and the acronym stands for Health Insurance Portability and Accountability Act. It's a law that's designed to provide privacy standards and protect patients' medical records and other health information provided to health plans, doctors, hospitals, and other healthcare providers. So the law has been amended several times, and it supports the following: patient information, privacy, patient access to their own records, increased security of information, and increased portability of insurance information and use. HIPAA security, privacy, and breach notification rules protect the privacy and security of health information and provide individuals with certain rights to their health information. Why does this apply to interpreters? The HIPAA privacy rule applies to organizations that are considered HIPAA-covered entities. So that's health plans, healthcare clearinghouses, and healthcare providers. It also applies to covered entities that work with business associates to produce a contract that imposes specific safeguards on the PHI, which is protected health information, that business associates use or disclose. So medical interpreters can be employees of healthcare facilities, which would be HIPAA-covered entities, or they could be vendors, in which case they are business associates of HIPAA-covered entities. This means that all interpreters are bound by HIPAA. There are no exceptions to this rule. This also explains why healthcare interpreters must sign a confidentiality and HIPAA compliance agreement, and all of you did that working for us. What is PHI? PHI stands for Protected Health Information. What that is individually identifiable health information that could be used to identify an individual. So someone's name, email address, or physical address, other information that could reasonably identify someone, concerns about their physical or mental health, their health care, or payment related to health care. It would have been created or received by a covered entity, and it can be maintained in any form, either oral or paper, electronic, images, etc. If the information is de-identified, then it is not PHI. So de-identified would mean if you use an example of someone that you have interpreted for to teach a class, for example, and you don't use any kind of particular information that would identify that person, then that would be okay. How does HIPAA apply to interpreters? As an interpreter, you log into your online scheduling platform and access appointment information, order forms. You print the order form containing the patient's appointment information. You also may place reminder calls to the patient's phone number and discuss appointment information. You may leave voicemails regarding appointment information. You will do site translation for patient information as you start your assignment. You take notes during interpreting appointments, and you carry appointment information, including PHI, in digital, paper, or oral format. Appointment scheduling. Think of all the steps involving protected health information. When an interpreter is involved in the scheduling service for a patient, first you receive notification of an appointment either via text or phone or by logging into the platform. Then as you log into the scheduling platform to confirm your availability and check the assignment information, you now have access to specific PHI. You will need to print your service order form containing specific PHI in order to fulfill your verification of service duties and get paid by All Access interpreters. When the PHI information collected on the platform, you can, when indicated, place reminder calls to the patient. When the call gets answered, you confirm you are speaking with a patient because their name is PHI. So when you're confirming, you do want to specifically ask if the patient is available or if you are talking to the patient. If you do not know who you're talking to, you should not divulge any kind of information. If it's for a child, then make sure that you are asking to speak to a parent or guardian of the child in order to confirm the appointment. You can also leave a voicemail if the call is not answered, and just give information about when the appointment is, and don't go too much into detail on your voicemail, just in case somebody else would be able to access that voicemail. You carry PHI with you to the appointment with your order form. And then when you get there, you introduce yourself to security and front desk personnel and explain why you're there. You confirm if the patient has arrived or if you need to wait for them. Once the patient has arrived, you will often have to help them with documents, so perform site translation with them. And then you tend to the appointment itself and take notes to assist with accuracy and interpreting. And while you minimize writing down PHI on your notes, you still write down some data that could be PHI as well. Once the appointment is finished, you should always destroy your notes, preferably in front of the patient and the provider so that they see you're not walking away with the notes. And you will also take your order form, your verification of service, and have it signed. Interpreters are mobile office workers, so as you increase your awareness that you carry protected health information with you at all times, whether it's digitally, on paper, or orally, you need to increase your awareness of your responsibility to protect that information. The following section will address how to ensure that the PHI you have access to as an interpreter is protected and in compliance to HIPAA. Privacy and security. They should be at the center of the interpreter's business. So you set the foundation for HIPAA compliance. As you see, you move around the diagram, you realize that all pieces in place are connected to and support the core principle of privacy and security. So first we have the connected world. So we live in a connected world, we all know that. We access PHI in our emails, appointments, and service order forms. We use our computers, our tablets, our phones. You use PHI to call a patient and appointment reminders. So ask yourself, how secure are your internet and application passwords? How aware are you of PHI when discussing with patients or patients' family and healthcare providers? How private is your space, your office, your car, the lobby, the street, when accessing and using PHI? So when you access PHI from your phone or from your computer, think about whether you share the computer or the phone with anyone in your home. I know that sometimes kids like to play with their parents' cell phones. So have you actually logged out of your platform, or are you still logged in, and could anyone just take your phone and all of a sudden see some patient information? So you really need to keep track of that and make sure that you are not leaving anything open and accessible on any kind of shared devices. While we tend to move everything digital, we still live in a physical world. We access PHI on the printed service order form. We travel with that form. We present that form to get signatures and receive verification of service. We need to then store that form in order to make sure that we got paid accurately or that we received the form. And you want to actually keep that form until you have been paid, but you want to keep it in a secure place and not anywhere in your home that anybody else would be able to access it or easily look at it. So are you aware of securing PHI on your form while you're traveling? Do you have them in a folder, or do you just have them out in the open, which you should not? So you really have to think about that and be aware and take precautions in order to really keep all of that information private. When we think about passwords, we want passwords that are difficult to detect by both humans and computer programs. Strong passwords should be at least 6 characters. You can do a combination of capitals or a lowercase, add some symbols and some letters. If that's allowed, you could have a different password for each different site, and maybe using part of that site in order to construct your password, just have some kind of a system. Whatever you choose to do, just don't have any kind of easy passwords or the same password for every single thing that you do, mostly with information that has PHI in it or anything related to your appointments. So you could, here's an example, you could, for example, say when you were born, and then you take each first letter and number of a sentence like that, and then you see that you're able to make a password. In example 2, you say, my first job was selling books in Paris 7th district. And then you make up a password with that. So these are some kind of tricks that you can use in order to create passwords that make sense to you and that you could easily remember, but that are not something that somebody else could easily access. Increased awareness affects both your connectivity and physical compliance to HIPAA. You use strong passwords to access the internet and applications containing PHI. You pay attention to your surroundings when accessing or discussing PHI. So if you're in the lobby and you have your form and you're talking to somebody else, make sure the form is not out. You want to put it away. You also want to make sure that when you're checking your forms, checking on the next appointment, that no one that is around you is able to look at the form that is not about them. So if you don't have to use it, don't. If we look at our National Code of Ethics and it supports confidentiality, you have to treat as confidential within the treating team all information learned within the performance of the professional duties. And you have to maintain confidentiality and not disclose information outside of the treating team except with the patient's consent or as required by law, and make sure that there is a written consent. This is not something that is going to happen to you a lot, that you would have to disclose anything. And the interpreter protects patient information in his or her possession, and the interpreter limits his or her professional activity to interpreting within the encounter. Some scenarios that violate HIPAA compliance would be telling friends or relatives about patients in the hospital that you've interpreted for, discussing private health information in public areas of the hospital, including the lobby or an elevator or a cafeteria. An example of that would be is that there's a long surgery and maybe there's 2 interpreters that are involved, and while you're on break, you're discussing what just happened with a patient in order to let the next interpreter know, but maybe you're speaking Spanish and maybe somebody else speaks Spanish and you're unaware of that, so you are actually violating HIPAA by divulging information in a public area. Discussing private health information over the phone in a public area. If you don't log off your computer or your phone. HIPAA regulations mean is a need to know includes, so the security guard, for example, needs to know who you're going to see, but that doesn't mean that you need to discuss any kind of diagnosis or anything like that with a security guard, because they don't need to know that. Also, a nurse needs to know personal and private information about a patient that's in her unit, but not about someone else, for example. A health insurance company, the same. They need to know about one specific thing about the patient, but not about the entire patient's history or payment history. And allowing members of the media to interview someone in a substance abuse facility. That would not be okay either, because that would mean that then their private information is out there in the world. And including private health information in an email sent over the internet. Be very careful when you do that, even when you write to us. You do not want to write full patients' names. You can use abbreviations, for example. We like to use the first letter of the first name and last name, and then maybe a date of birth, or maybe just an appointment date or something like that, so that we can look it up. So that you don't have that written in an email. And releasing information about minors without the consent of a parent or a guardian. Some of the most common types of HIPAA violations among interpreters would be lost order forms or invoices, lost or stolen devices, cars getting broken into, employees sharing non-relevant PHI with interpreters, lack of training which leads to the breach on behalf of the clinical staff, so they tell you too much information even though you're not interpreting at the time, and overhearing information not intended for the interpreter. So if you overhear information, just make sure that you keep it confidential. So what happens if we don't follow HIPAA compliance rules? There can be fines, and they're really serious. So if if it's the first time that you're violating HIPAA laws, you could, and that you can prove that you were not aware that you were doing it. You could have fines as low as $100 or up to $50,000. If you are found to have done willful neglect, but that you corrected it, there's still a minimum of $10,000. And then if it is willful neglect and that you're not correcting it, then the fine goes up from there up to $50,000. So these are, really serious fines, and that's why you really have to keep HIPAA in your foremind whenever you work and interpret and carry around information. HIPAA is not an optional thought. Medical interpreters have to comply with HIPAA rules and protect confidentiality at all times. They should always be aware of physical and digital security and preventive actions with strong passwords, high awareness, by logging out of your information when you're not using it, or on shared devices, and keeping all the physical information private when you go to appointments. All of those things are easy to do if you stay aware of them, and it's much better than to deal with a breach. And you are now going to move on to the quiz part of this, and you will have to complete the quiz and actually pass it in order to receive a certificate of compliance. So I thank you for listening today, and I wish you good luck in the quiz. Thank you.